In the wake of the Buffalo, Uvalde, and increasing gun violence across the country, many now pointing to mental health as the answer to prevent future shootings.
News 10 ABC's Skylar Eagle speaking with a mental health professional who says the answer is not that simple.
The idea that the mentally ill are violent is really a misconception. We've got to start to knock that down. It's just not true.
Christy Leviner-Wright is a licensed clinical social worker who says professionals have a duty to warn if someone has the potential to harm themselves or others, even though data from the National Library of Medicine shows less than 5% of mentally ill people turn to violence. And an expansion to an already existing red flag law passed by New York State could help make it easier to report warning signs, especially when it comes to suicide and domestic violence.
It's really going to depend on how workable and how flexible that law is. And if it is, in fact, an immediate red flag, and if there's enough communication, it could potentially save quite a few lives.
Leviner-Wright says if pressure is put on mental health services to curb violence, they could be forced to do these that just aren't possible, resulting in an increasing shortage of providers and resources. Instead, she says there needs to be a clear path on how to prevent people who shouldn't have guns from getting them.
I don't want guns taken away from everyone. I don't think that would be smart. On the other hand, we have a clear path as to who should and at least who should not have access to guns. So let's start there and see what happens.
Mental health advocates worry a push to rely on counseling and psychological services to curb gun violence could discourage people from getting professional help.
People are on edge and very nervous about how they will be perceived because they have a chronic mental health condition.
Reporting in Albany, Skylar Eagle, News 10, ABC.